It's always a 14 by 17 crosswise. So SID is detented, Bucky horizontally detented, longitudinally lined up. We're good to go. And now, Allison, let's move your hips a little bit to your right, just your hips. I'm at left. I'm at your other eye. Okay. Okay, face needs to be nice and straight, and then always find crest. So go to crest. And remember, we need to be mid-sag and halfway between aces and pubic symphysis. I gotta get this going. Okay, so. And I always look to see that I have light to top of crest most of the time. Then I look at aces and I look at where my center rays fall. Okay. And then of course you can look at your patient because we need the proximal femora. We're gonna right the upper third of the femur. So, and let's put your arms down to your side. I just really want to make sure I am directly mid-sag. And you see I have light on the table on this side, but not that side. Not quite mid-sag. Now with Allison, probably wouldn't have to be, but a lot of patients, greater trochanter to greater trochanter, you got to be exactly mid-sag, or you're going to be clipping one side or the other. All right, marker. I a lot of times put it in up here by the waist because the crest curves in, right? You got a square. You got a square space right here. You know, right here you got that. You've got that space to put it. So right there, that's a good place to put your marker. All right, and then Allison, what I'm going to do, we're going to take your heels, we're going to move them away from each other, but then let's have those toes touch as much as you can without being too uncomfortable. And then what I want you to do, take a breath in, blow it all the way out, and hold it out. Don't breathe or move. Okay, you can go ahead and breathe and relax. So again, mid-sag, halfway between aces and pubic symphysis. We need crest on, we need pubic symphysis on, we need like the upper third of the femur on there. So now we're going to go right to the AP hip. Right to the AP hip. So collimate down to about a 10 by 12. And we can kind of just look at our light field now and know. Or else, if you want to put a 10 by 12 in, do that too. It's up to you. All right, so now we need the center ray to be to the neck of the femur, right? At the end, we're going to do the very same thing again, but not yet. So here's aces. By the way, aces is always directly anterior, right? Now aces is big. I mean, you can be here and think, oh, I'm at aces. Well, you're not really yet. Or you can be on the downside of aces. So you want to be on the most prominent portion of it. But anyway, remember, we're drawing this imaginary line, hooking aces and pubic symphysis. And then at the midpoint of that line, we're bringing in another line that is perpendicular to it. And we're going 2.5 inches down to locate the neck of the femur. Okay, and of course, always look at your patient's, femur too. Now here's the bone, but the neck of the femur is up here somewhere, right? And I'm just looking at, and I don't know if I truly went to a 10 by 12, but you will have a dial on here that tells you you're 10 by 12, and you should do that because you can use that. You can use that light field to tell you if you're positioned correctly. Get used to that because that is invaluable. All right, so we're about, and by the way, you can just tell me everything's done on expiration. We don't need action for that patient. All right, so again, we're gonna bring those heels away. Oh, and my marker, moving in. And she's suspended respiration. We've got our x-ray done, you can relax. Now you can just do one leg, but I tell you, your patient will always do a better job if you use both legs. So, all right, now you would have just seen this x-ray, right? You would be out there within seconds, you'd see it, you'd know if your center ray was correct. We're going to assume that it was, for our comp. So now it's just the frog leg. This is a unilateral modified Cleaves, right? So now what we're going to do is have you flex this knee. Now I'm going to draw this foot into your other, somewhere up here by the knee or a little bit below it, right? So I've got a lot of flexion here. How much do we abduct the femur again? 45. 45, that's it. Marker should be fine. Okay, and watch your patient's hand. All right, just like that, I want you to leave your leg just like that, okay? And then I would have her hold her breath, take my image, we're good to go. All right, let's let you relax that leg down. All right, so, let's put you back up there. Now you can keep this just like this, or you can do this, either way. Some techs prefer one over the other, but they're both fine. So, all right, let's go ahead and extend your leg down. And now we'll get you off the table. All right, Emily, let's have you be our technologist.